There's a lot that goes into prescribing medications safely and effectively. For nirmatrelvir-ritonavir, there are a few things to note. One, I'm only talking about adults and pediatric patients 12 years of age or older who weigh at least 40 kilograms. Two, nirmatrelvir-ritonavir is packaged as a combination of two types of tablets that the patient must take together. If they take only one, then treatment won't be effective. We as clinicians may be familiar with this, but it's important to explain it to the patient. My suggestion for what to say is something like this. This medication works a little different than you may be used to. You have to take the pink tablets that contain the medication designed to stop the virus and the white tablets that allow the pink tablets to work. If you take one or the other, the drug can't beat the virus, so the virus wins. The third thing to note is that you have to use the correct dose for the person, taking into account their kidney and liver function. And the way you write the prescription matters. The FDA really wants you to get this right. So in the prescribing information, they say prescription should specify the numeric dose of each active ingredient. This means they want you to write out the exact dose for both nirmatrelvir and ritonavir. So what does that look like? The regular dose is used for people who don't have impaired kidney function, defined as an estimated glomerular filtration rate, or eGFR, greater than or equal to 60 mils per minute per 1.73 meters squared. It's 300 milligrams of nirmatrelvir, so 2 150 milligrams tablets, taken with 100 milligrams of ritonavir, so 1 100 milligram tablet, every 12 hours for 5 days. Your individual electronic prescription system may have some variations, but you get the gist. For people with an eGFR of 30 to 59, we need to reduce the dose to 150 milligrams of nirmatrelvir taken with 100 milligrams of ritonavir every 12 hours for 5 days. For people with an eGFR less than 30, nirmatrelvir-ritonavir isn't recommended. This includes people on dialysis, so you'll want to prescribe an alternative. There's some evidence that it can be used in people with an eGFR less than 30, most notably from the Ontario Renal Health Network. But this hasn't been changed in the prescribing information or the guidelines at this time. So what about patients with liver dysfunction? Well, no dosage adjustment is needed in patients with mild or moderate liver impairment. There's no data for either component of this combination in patients with severe hepatic impairment, so it's not recommended and you'll want to prescribe an alternative. The fourth consideration is side effects. People most commonly report taste disturbances, diarrhea, and muscle pain. Sometimes people have elevated blood pressure. We want to counsel patients that these may occur so people know what to expect.